you have tens of thousands of Canadians who died waiting for medical care last year alone. So this is like kind of like
It's probably
medical,
all in Quebec.
yeah, or Ontario. This is like medical assistance in dying, except you actually wanted to live and your medical system is just collapsing because of the influx of population growth we've seen in recent years, coupled with the influx of mental health crises, opioid addiction, and other health issues that, I don't want to say that necessarily like the novel thing that was coerced onto everyone and their child up until their elderly aging grandparent. What kind of health effects does that thing have on the greater population? So these numbers are absolutely crazy in a supposed to be a first world country with world-class healthcare, right? Canada's socialized healthcare system has been a talking point for generations as the like world-class leading cutting edge place to be for healthcare. And yet we have thousands, tens of thousands of Canadians dying on wait lists thanks to our world-class healthcare system.
And this is so ironic because during the COVID-19, they were saying to you, you really need to get vax. Why? Because it's for your health. It's for to protect the population. And when it comes to when you're really, really, really sick, you have no services. You are left by yourself in an emergency room for hours until like you're suffering too much that you're asking for maids. In Quebec, maids is the champion. Our system is so broken. This year, it would be $64 billion that we are injecting in this healthcare system that is just not working. There is so many people. Just as right now, I'm actually speaking with a father of two, and he's just watching his wife dying. And every time they are showing up at the hospital, they are signing vacancy and they just say, you need to live. Like, we can't do more for her. But she is literally dying. Like, now it's just bone. Like, she lost so much weight. Her skin is like falling apart and there is no help. And that mother, she's literally younger than me. Can you imagine that? Like,
it's terrible.
It's terrible.
And we pay forced taxation into this system where we can't even access care if and when we need or want it. And instead of being able to save a nest egg to, maybe go to another country like the United States, like Mexico, where you can pay to get great quality care immediately, well, we're stuck paying something like 50%. I think it's upwards now. 40 to 50% of our income goes toward taxes to contribute to this world-class healthcare system that isn't actually helping anyone. And just on your point, Alex, about Quebec probably being the worst, actually, it was Ontario. So Ontario was recorded to be the highest number of waitlist deaths at 10,634. Including more than 9,100 diagnostic scan deaths where patients died before even reaching the point of receiving or being scheduled for surgery. They couldn't even get scheduled in.
If you put like the population versus how many die in the emergency, do you think it's worse in Ontario or Quebec?
Well, then they said Quebec was second with 6,290 waitlist deaths, while BC followed with 4,620. And then the smaller provinces also saw a number of deaths.
It's funny, it's everywhere where Mark Carney kind of like got elected.
Ontario's cardiac data alone showed 355 deaths among patients waiting for heart procedures. So, we had something in recent years that damaged people's hearts at a level that we had never even seen with things like myocarditis and pericarditis. I didn't know what those things were prior to 2021.
And really rare disease. Really rare disease.
Just commonplace.
Like there is an increase of really rare diseases that we never heard of that before. There is an increase of that, especially with the skin. Have you seen that? Like with the skin,
Yeah,
there is
sepsis.
yes, there is a lot of people who have like skin diseases.
Yeah. And then the report also goes on to contrast this with the funding, because funding isn't an issue. At 244 billion with a B, public healthcare spending from 2024 to 2025 reached a historic high, with per capita spending tripling to 5,943 from the mid 1990s. Canada also remains one of the world's top healthcare spenders.
Wow.
Well, we have tens of thousands of people dying on wait lists, with a portion of them in Ontario not even able to get onto the wait list. They're just like in perpetual, we'll call you with a time sometime soon, so hang tight and hope you don't deteriorate while you wait. This is craziness. And what I found, I did a report on it about a month or maybe more ago, that the only person, people, or industry that benefits from any of this is actually big pharma. Because the longer you wait, the worse your condition gets and the more medication you need to manage it. And so this isn't helping the average Canadian. This isn't helping anyone except for lining the pockets of the trillion-dollar industry, the pharmaceuticals.
And most of the time, I don't know if you saw, but they are treating the symptom, but not what it is exactly. Exactly with the story of this father, his wife is being treated with medication to help with the symptom, but not with the disease.
Yeah, pharma is just a band-aid solution. And there's a time and a place, don't get me wrong. I think there's a time and a place to manage infection and manage pain. But obviously this system is set up to profit the pharmaceutical industry and not actually achieve real health. And that is evidenced just yesterday, where CBC reported that in Winnipeg, a daughter is sounding the alarm after her mother died following more than a 30-hour wait for care. 82-year-old Genevieve Price's death is being investigated as a critical incident, said the Winnipeg Health Authority, because she died waiting more than 30 hours just to receive care. She said her hand, she had a swollen hand, and she went to a minor injury clinic for care last week. They gave her IV antibiotics, and they said that she required more intensive care. Her daughter is a nurse, so she then brought her to the hospital, and then she was put on a stretcher in a hallway, and she waited there until she died.
Oh my God.
Sorry, no, she was transferred to another hospital where she waited before she died. This is absolutely terrible. Absolutely terrible. And her daughter's a nurse. So this is someone who's familiar with the healthcare system and can adequately and appropriately advocate on behalf of her 82-year-old mother, who still died waiting for care at the hands in a hospital on a bed. This is the world-class healthcare system that receives, what did I say, $244 billion of funding every year.
And by the way, I literally experienced it with my mother, who was waiting for a new hips. And she had to wait for about 3 years when she was not even able to walk anymore. She was in pain. She wasn't able to sleep anymore. And at one point she was looking at maid because it was just too long. And if you go to the private clinic, obviously it's really expensive. And if you don't have like the money for it, like it's not everybody who can go to the private clinic, but Mark Carney would be able to go. All our politicians would be able to go because they have the money. Where during this time, they look at us. They don't want to do any reform. They don't want to change anything in our healthcare system when they know that it's not working, and we just continue to pay for no service.